Welcome to the Fresh and Fired Up podcast. I'm your host, Dr. Emily Marshall, here with my co-host, the wild women's health coach and trainer, apparently, Haley Pindle.
You always say that. What do you mean?
I don't know.
It's not sketchy.
She's actually an expert. She's so great. You guys should check her media out. It's super fun. She helps a ton of women with their health. And we are excited today because we have a special guest. But before I introduce her, I need to say let's get fired up.
Let's get fired up.
Yeah, we are getting fired up today. This is the women's health podcast that you've been missing in your life.
Yeah.
But since you're listening to this episode, you have now found it, and that is great.
So hit the subscribe button.
Yeah, subscribe on YouTube, Apple Podcasts, and Spotify. I would like to introduce Dr. Shabita Teja. And I practiced her name before, and if I messed it up, she's going to correct it. But she is a lovely naturopathic physician from Vancouver, BC. She went to UBC. She is practicing currently at the Sinclair Wellness Center downtown Vancouver. And she has a really inspiring story, her own story, and then how she is helping so many people in the health and wellness space right now. So welcome to the show.
Thank you so much for having me. I'm excited to be here, and you didn't butcher my name. It was, perfect.
Okay, good. I'm glad. It's a beautiful name.
Thank you.
Tell us a little bit more, just to start off, about your story. Like, we want to know about you and what brought you into the health and wellness space that you're in now.
Yeah. So I have a long health history. It's pretty much how I describe it. It's had lots of ups and downs. I basically, perfectly healthy childhood, healthy as a horse, right up until 19, no issues other than, the occasional cold and flu here. And I know, my sister, Shahana, which is how, we got introduced, Dr. Shahana Alibai. So, it's just me and her growing up totally healthy. And then all of a sudden, age 19, I wake up with like excruciating pain, blood when I'm going to the bathroom. And next thing I know, I'm on the couch for the whole December break. I was in first year of college at the time. So I was still local. I, grew up in Abbotsford and was still at home. All, on the couch during Christmas break, and literally 20 pounds were lost in those 2 weeks. And I had no idea what just hit me. Turns out I got diagnosed with ulcerative colitis, and it was a really aggressive, intense, severe form. So right now, actually, my colon is in the medical school archives as like one of the worst that they've seen for, I guess, a 21-year-old by the time I had the surgery. So spoiler alert, my colon is gone. I then went back to school. I was in pharmacy school at the time at UBC. And so it took me a while to finish. And I thought, okay, great. I'm finished. Things are going well. I had an ileostomy bag for 2 years, and then had it reversed. So basically internalized. So I still don't have a colon, but what they call a J pouch surgery. So my small intestine basically functions as both a small and large intestine. So, I make accommodations that way. So I'm going through the program and realizing that there's got to be more than just medication, because medication really helped at the time, but I was looking at alternatives. And so naturopathic medicine is where I stumbled upon during that whole process. And I went pretty hard into it, but my family is very conventionally medically driven. So my dad's a pharmacist, my sister is a medical doctor. And so especially my dad was sort of like, you're a pharmacist, why are you wanting to do naturopathic medicine now? So it just wasn't accepted, but I went into that program, but I got really sick in the end of my first year again. And I was like, what's going on? I thought I had my journey, my big one and done. And it was a really devastating process to go through like emergency surgery and an ileostomy and, between the ages of 19 to 24, basically, and be told at the end that you're 80%, there's a chance that basically 20% that you'll have kids with the surgery. So I'm making that decision at the time. And then at the end of my first year in naturopathic medicine, I have severe epigastric pain, so upper abdominal pain, and I'm throwing up and going into the emergency room. And it turns out it was gallbladder related. And so my gallbladder was removed. But I had, and my mom still remembers this, is that I had this moment of, I guess now looking back, it was like, universe or godly clarity. And I said, what if I wake up and the pain is still there? Like something in me told me that it wasn't gallbladder related, but everything else pointed to that. And I was still, again, very conventionally driven, because that was my family and my way of acceptance. And so we did the gallbladder surgery. I woke up with the exact same pain. And in fact, it was way worse. And so, long story short, we'll talk more about this, I'm sure, about the chronic pain journey I'm on. But I spent probably like 5 or 6 years after that. It took me 9 years to complete a 4-year naturopathic medical degree, because of all of this chronic pain stuff, because nobody could figure out, why did you go under the knife for gallbladder surgery, come out for a routine procedure, and you're even worse. And now we know the cause is that it was my nervous system just saying, like, basically fire alarms. It's you're in pain, you're in pain, you're in pain, and it just never shut off. So I have a spinal cord stimulator, but I went through a really tough, again, 5-6 years of in and out of emergency rooms and hospital stays, like 3-week long chronic inpatient pain program stays. I went through that 5 times. I was on IV ketamine comas, where like literally I'm like a stage before death to bring down the nervous system. Again, all medication. And this is while I'm going through naturopathic medicine. So I know there's something else out there, but I'm not strong enough to actually get to that point where it's like, no, I've solved, I've cured myself using naturopathic medicine. I wasn't there yet. But I'm still on that journey, and I have a spinal cord stimulator. I'm off of all of like the ketamine and Percocet and all of the, antidepressants that they put me on, and anti-anxiety. And because everything was like, it's in your head, it's in your head. So it was a classic one of those where, I just didn't want to acknowledge that in my head. And that's what I'm, experiencing right now, is that being connected to your emotions doesn't mean that there's something wrong in your head, right? That this is like the process of healing. And so I've worked with, a psychic life coach, and now I'm working with, this intuitive, just like somebody that she's not like a counselor, she's not a nutritionist, she's not like, my parents were all like, what degree does she have? And I was like, she doesn't have any degree. She's cured herself. And just Jody Galeen is her name. So she's really like helped me the last, I would say, almost 6-7 months of figuring out, unpacking and peeling back the onion as to like what's going on trauma wise. It doesn't have to be that I was like, abused or anything physically, because that's not what happened. I had a great childhood, but like all the stuff that I've gone through with surgeries and doctors and being told like, it's your fault, peeling all of that back. And I'm on my last narcotic medication, and I've come down considerably more with this work that I'm doing than anything before. And so now that's the work that I do with patients, is like tell them and kind of walk alongside the healing journey for them, meet them where they're at, and then walk alongside with them and support them, because that's something that I didn't have. I didn't have that support person that was like unconditional, that I had trust in, because every time the rug would be pulled out from underneath me, where a doctor would be like, oh yeah, we got you. I understand exactly what's going on here. You didn't respond after the surgery like we thought you would. It's in your head. And so every time I felt like this crushing blow to that trust that I had created. And so now I want to honor that relationship with the patients that I see. And so I usually just say, like, I'm a primary care naturopath. I, basically take in whatever walks through my door, but I do attract what I'm interested in. So it tends to be GI related and tends to be pain related, but everybody has a root cause of stress and inflammation and emotion. Like, I mean, I always, talk about the healing triangle at the beginning of each of my appointments. And that's like physical health, mental health, emotional health, and then spiritual consciousness, whatever that means to you, kind of overlying all of that. And where does your center of gravity fit into that? Where are you being pulled, and how can I get you back into the middle so you really live a life of like authenticity and vitality and truly, feel grounded when you wake up each day. So that's what that's I know I said a lot, but that's sort of like, it's a long journey, but yeah, that's where I'm at right now.
Wow, that's a lot. And
Yeah, I
for
know.
what it's worth, I'm so proud of you for going through all of that. One question that popped into my mind while you were speaking is, if you had to like go through it again, or you had a patient that was going through the exact same thing, what about our healthcare system right now would you have changed?
Yeah, that's a great question. There's so much, like, so we're in the Lower Mainland in Vancouver, BC, and like, I understand we have, we're so fortunate in a way that we have access to free public health, and um, I think that our medical school system needs to be overhauled a little bit. And I'm being nice about that. Like, I mean, a lot. So like, there is no, and we can, Shahana is a perfect example of somebody that really tells it as it is. They don't get any nutritional training. They don't get any emotional training. She had to, I mean, she's written, her book, Feel Better, but that's because she went through her own journey, and then figured it out after she was a doctor. So I would say that it starts at meeting that practitioner where they're at, and where we can catch them is the educational system, because once they're in the residency program, they're too far gone. They already have the ego of like, what I say creates and what I say is, you know godly, basically. And I'm not being facetious at all. It's just that we are promoting that sense of like an ego maniacal version of themselves from the get-go, right? You just getting into medical school is like, oh my God, you got in, you're, so amazing. You must be so smart. And like, we're just training them from that onset. So then anybody that challenges that, or challenges their decision making or their final say, which is what I did inadvertently, and enter me as like a perfectionist and wanting to be, I was trained to be like the perfect daughter, the perfect student, the perfect little girl, like, so I wanted to be the perfect patient inadvertently. Now that's the stuff that I'm learning. And so when that clashed, and I'm like, I'm actually not responding to what you're saying I should be responding to, that was then turned against me. Instead of saying, listen, I'm not God, I'm not all knowing as the doctor now, what can, like, how can we both work together to figure this out? And I think what's missing is that emotional component, the mental health aspect, the emotional health aspect, and then just like the missing portion of physical health, which is that foundational layer, which is lifestyle, nutrition, um, and healing from the inside out. I think like it would just be a couple of courses just to get them, to get that introduced, really.
Yeah,
And so
and I
that's what I
agree.
say is a big missing
Yeah.
piece.
I agree as well, for like not only the doctors and like lowering the ego point of view, but also for the patient. Like I feel like a lot of patients go in without really knowing their own body or understanding of anything. So they do
Yeah,
trust their doctors, which I'm a very big advocate. I work with women who don't have their cycles, kind of have disordered eating. And a lot of them go into the doctor's office and they prescribe the pill, not knowing what the kind of repercussions of that is. And
yeah,
it's just so important to be your own self advocate as well, and just knowing that, oh hey, I'm not really comfortable with this, and having that kind of doctor and patient relationship be a little bit more mutual, and have both of them have a better understanding of how much control you actually do have from the get-go with like nutrition and lifestyle and emotional regulation, like you said.
yeah,
And it's interesting when you have that open dialogue. So my background as being a chiropractor, it's, you have some patients who hyper educate themselves on Google, and sometimes the information
Dr.
is like,
Google.
that's,
yeah,
yeah, Dr. Google. You're like, that's not quite, like, they're convinced that they have something, and you're like, I genuinely don't think that you have this. And there is that psychosomatic component. But then the flip side, like you said, Haley, where there's very much a lack of an awareness. And as the practitioner, I think it's so important to actually explain the risks, the benefits, and the alternatives
yeah,
to care. And I don't know. I'm not going to do a whole bunch of like provider bashing on this episode, but
Yeah.
I find it intriguing. Like, I know my husband and I both work in chiropractic care. And there's oftentimes we question when a patient comes in and they've been to another practitioner that hasn't told them that there's any alternatives. They're like, did they not go through with you? Like, here's what we think you have. Here's, you could go this direction, or that direction. And here would be the risks and benefits to those. And like you said, Dr. Shabita, where you're like walking through it with them.
Mm-hmm.
And I think a really good thing to think about whether you're seeing a naturopathic doctor, chiropractor, physiotherapist, medical doctor, any of us, if that practitioner is willing to work integratively with others, that's a really good sign that they're not ego driven. Yeah. So I know there's so many times when patients come into our clinic that they're like, yeah, I'm going to go see this neurologist. And we're like, oh, that's great that you got into the neurologist. Let us know what the reports are, or let us know about, we'll take a look. If you'd like us to take a look for that at your MRI as well, we're happy to do so. We're not like, oh, no, don't go see the neurologist. We're taking care of you, right? Or we have had physiotherapists who are like, no, do not let the chiropractor touch you. And you're like, what? We are usually like, yes, please go see a physiotherapist. Please help them to focus. They're going to focus more on the rehabilitative side. We're going to focus more on making sure that we're getting you adjusted, getting your nervous system working well, that sort of thing, right? So I love what you said. Your story is horrendous in the sense of how, that practitioners just kept dropping the ball on you each time. But it's truly amazing that you've been able to kind of come around in your own journey and see your healing process, become aware, and then be now able to walk alongside others. I think that's really powerful. So thank you for sharing that.
Yeah, I also have another question for you. Sorry to interrupt you. One of my clients has exactly what you had, and this question's dedicated to her. What was the biggest like nutrition shifts, movement shifts, lifestyle shifts that you did make that yielded the best kind of like pain-free results? Like your gut was healing to some extent, pretty much pain-free. Like what were the biggest things that you did?
So I usually describe it as like I have different tools in my toolbox at different stages, right? So what worked for me, back in my colitis period was something very different than what works for me today. So what I tell patients always is that this is all about individualized care. So something that works for me might not necessarily work for you, but you will also have to figure that out as you go through your journey. So I'll just say briefly, like in the colitis period, I was on a no wheat, no dairy, no gluten, no caffeine, alcohol I don't drink, but that was pretty much like restrictive, because that's the type of naturopath I saw at the time. So did it help? Yeah, in that stage it did. It contributed to more weight loss, but I think it brought the inflammation way down. Did it save my colon? No, but I think it did, like I said, bring the inflammation down. So at that period, yes, it helped. Now, am I no wheat, no dairy, no gluten, no caffeine? No, I don't follow that right now because that doesn't work for me. But I am very much about, I do regular juice fasting now. I really promote whatever is the easiest to digest for my system because I don't have a colon. I drink a lot of water and electrolytes with that water because I'm not reabsorbing that. So it's individualized for me. Lots of smoothies and soups. But that, again, that works for me. So that is more like where nutrition and, physical medicine, lifestyle, it has to shift with your lifestyle and what is the most important. Like when a patient walks through my door, I'll ask them like, what is the biggest concern to you right now? Because they'll usually have their health concerns written, 1, 2, 3. I'm like, we're going to get to all of them, but what's your biggest concern and why? And that's usually where we start. And usually from all of those, 3 or 5 or 10, lists of concerns, there's 1 or 2 common root causes. And like I said, usually it's like stress, usually it's inflammation. So we work on nutrition from that aspect on lowering inflammation. Like what's the biggest tool that I can give them at that point. So for your patient, for example, your client, like it would be about lowering inflammation. And how do you do that? If it's an autoimmune driven illness or disease, that would be lowering antibodies. And how do you lower antibodies is to not put more of those in your body, which is usually dairy and gluten are the biggest ones. But I always tell patients, like, look at a food sensitivity test, because you'll know exactly what your immune system is reacting to in this moment, right? And that changes 6 months down the road, even, because our antibodies are always changing. So, I mean, we could do a podcast just on food sensitivities. We could do a podcast just on, like autoimmunity, or just on energy healing. Like there's so much there, but for your particular, client, it would be about lowering that inflammatory index pretty much. Yeah.
Yeah. That's so interesting because it makes me think of too, like there's so many aspects. I love that you said 6 months down the road, because I think people want to latch on to a diagnosis or latch on to like, I'm allergic to this and I'm allergic for life. But
Life.
that
Yeah.
ebb and flows, like as you heal, it's like you said, foods for someone who has a colon versus doesn't have a colon is going to look different. Foods, depending on what you've been through in your medical history, your surgeries, the medications that you've been on or not, your physical environment,
Yeah.
and then the foods themselves, but then what is on the food themselves. Like personal example would be there were certain things I was reacting to and I was thinking, oh my goodness, am I allergic to blueberries? But then I realized I just wasn't washing them well enough. Like if they were heavily sprayed non-organic blueberries, I'll just pop some in my mouth, but then I'd eat a bunch of them and be like, oh my gosh, I feel like my skin is itchy. Well, if I let, this is just like a random example, but really becoming aware of what might be increasing that inflammatory response in your body. And for me, it tends to be more chemical, that I'm like, oh, if I use too aggressive detergents, plus I've now had like heavily sprayed fruit that I didn't soak really well and wash really well, then all of a sudden I'm like, I feel like I'm having a reaction, right? So, I'm bringing that up because I love that you are looking at it from such a wide open lens. And how does that then affect each individual rather than the blanket of one thing works for everyone? Like, I do think that there are main staples in our diet, obviously, where we're going to have the best sources of certain nutrients, right? Like you need
Yeah.
to have certain things. You need to have vitamin D, vitamin B's. You need those.
Yeah.
But it's like, okay, how are we getting your body to absorb them best?
Yeah.
And so through your process, what do you do for helping people along the timeline? Like when they come into you, because you mentioned, they might have 1, 2, 3 problem.
Mm-hmm.
Now you're kind of honing in on what is most important to you right now. You start working with them on their journey. And
Yeah.
then what does that journey typically look like? I know it's individual, but like what
Yeah.
would be some of the overarching steps that you go through?
Yeah. So, like, let's take an example of, because we're talking about, GI, gut health, and food sensitivities. So, say, for example, like, I just had a patient come to me last week saying similar. He had really itchy skin, really dry skin. And then he also said that he had some, joint pain, ankle pain. But it was just one sided. And sometimes, and this was the key that tipped me off, is that sometimes both bothered him. And I was like, oh, that's funny, because usually like one side is an injury. And then the dry skin, which, we'd gone through. And this is where my intake form is ginormous. And I do it for a reason, because we go through that in the hour appointment. That is a mandatory 1 hour initial appointment. And this is where I tell them, like, I'm not going to be talking a lot. I'm going to be typing. I'm going to be engaging with you, but you're going to be doing a lot of the talking. And I'm going to be asking you a ton of questions. And then around the, 45, 50-minute mark is where we'll get into sort of like, what I recommend your top 3 takeaways from this appointment will be. Because people need something to like hang their hat on, at the end of the appointment, where it's like, I give them water or tea, because they're talking a lot. And they've probably done this. If it's like me, they've probably done it, close to like, I'm not being, I'm not exaggerating, like close to 100 times I've probably recounted my history over the years, right, to
Yeah.
different practitioners. So you get tired of saying the same thing, but you're like, if I want to get help, I'm going to have to recount this. So I try to make it as comfortable as possible for them and let them fill out the form, in as much detail or as little detail as they need to. We all have busy lives. They're not going to sit and fill that form out as, if they don't have a lot of time. But I go through that to make sure all the, T's are crossed, their I's are dotted. So we go through that in the hour-long appointment. But for this patient, he was feeling really itchy, but I'd asked about, like, any changes to detergent or chemicals, or do you have this every winter? Is it just dry skin from our environment? And it wasn't that. And he had always wanted to find out about foods. And this is where, like, the more that we peel back that onion, I'm discovering, like, this is really about what he's putting into his food. And then we get into, he leads a really busy life. He's single, lives on his own, picks up a piece of pizza pretty much every night because he doesn't cook. He's got a really low appetite. And I ask everybody I call it, or, naturopathic medicine calls it STEAMS, which is an acronym for stress, temperature, energy, appetite, modalities, mood or Menzies, and stress or sleep. Like, so that's really much what we're going through, besides your full medical history, family history, social history, and then like a review of systems. So it does take a good 45 minutes to go through all of that, but I find I get the most information from that STEAMS portion. And so when I'm figuring out and seeing that he's actually not eating, not only not a complete nutritious diet, he's actually not eating enough. And then I'm figuring out that, okay, this is somebody that needs to look at food sensitivities. So we do a food sensitivity test. And at the end of that, I'm telling him that, this is what I recommend for you, looking at cleaning up your diet. And what does that mean? So really at the end of it, I'm not going to give him like a huge diet handout on what to do and tell him, don't eat this, don't eat this, don't eat this. What I like to tell patients is, this is what you can do. We can do a food sensitivity test to easily show you what you're reacting to. And if it comes up that you're reacting to a lot, maybe you have leaky gut, and this is what that means. For him, he wasn't drinking enough water. I usually, at the end of that appointment, the 1, 2, 3 points are usually, I need blood work. Make sure you're drinking enough water. Here's some, a name of an electrolyte that I really like. And then looking at, do you have a counselor? Are you talking to somebody? What brings you joy? And are you talking to somebody about things that don't bring you joy, or your stress management techniques? Because usually that's what people need the most help with. And I'm not a one-stop shop, just like we were talking about earlier. I'm collaborating. So with blood work, I'm recommending that they go to their GP and get lab requisitions, because with me, Life Labs in BC, naturopaths can sign for it, but patients pay for it out of pocket because I pay for it. So I'm like, if you can engage your GP that way, let's do it. And let's like work together. So now all of a sudden I have a touch point with that GP. I have a touch point with the counselor. And I'm making sure it's easy for the patient to connect with those practitioners, because I'm giving them something to go to that practitioner and say, I need X, Y, and Z. And usually at the end, like, I'll send an email with the information that we talked about. It's hard for patients to it's hard for people to keep track of, three things, because our lives are busy. So it's in their email ready for them so that they know. And then I follow up, and usually we have like a 20, 30-minute follow-up within a week, within 2 weeks, depending. I also do a lot of IV therapy. I find that gives like the biggest bang for their buck. And gives them a glimpse of what it could feel like to have energy, to have a better night's sleep. And then they're like, oh, I really am depleted. So it is a more invasive therapy. But for me, over the years, I found that even just one small 15-minute IV, given that, they don't have any contraindications, which usually there's not a lot for IV therapy, that usually brings them in and gives me, again, another touch point where I can like connect with them. Have you gotten blood work? Have you, followed up with your counselor? How's that water going? Like, do we want to book the food sensitivity? So it's like making sure that they're engaged regularly, because patients need the most help in those I would say, first 4 to 6 weeks. And then I am happy if I only see you every 6 months. That's what I usually say. Communicate, over email anytime. there's no charge for that. Anytime, complimentary. If you're in the nutrition natural pharmacy aisle and you have a question, take a picture of the supplement, email to me. Like, that's all included, because again, I want to walk with them on that journey, and keep my boundaries, right? I also have to take care of my boundaries and not give myself over to every single patient. Otherwise I won't have any longevity in this career. But yeah, that's what I usually do, is make sure there's regular checkpoints, especially in that first 4 to 6 weeks. And then usually people are feeling like a heck of a lot better in that 6 to 12 week period, and then we're just checking in once every 6 months ideally. This is like a small example, but obviously different for autoimmune, different for chronic conditions. But something like this, like I'm going to be seeing that patient next week, and we're going to go through his food sensitivity test, and we'll start like a gut healing protocol to heal the leaky gut. And that's just, a simple supplement. We'll talk about removing those food sensitivities. But again, it's not like for life, it's for 3 months. And then we start to introduce the foods back again. But once the lining is healed. So I'm as much a teacher as I am a naturopath. And that's what I really enjoy about the profession as well, is that I'm teaching patients about the body pretty much every visit. So yeah, that's kind of the timeline.
So follow up then, just to dig
Mhm.
a little bit deeper in some of the areas. Can you
Mhm.
give us the basic range of water recommendation that you would
Yep.
give? Water, you mentioned an electrolyte supplement that you like to recommend. Can you give us those two things? And then as well as blood tests, like what should people be asking their GP for when it comes to blood tests? Because I know there's like the very basic, right? Like usually you get very basic blood work here in Canada anyways.
Yeah. Yeah.
Can you give us those three things?
So yeah, those three things. So for water, it depends on your height and weight, obviously, but pretty much 90% of patients will be in the 8 to 10 glasses. So 250 mils, 8 to 10 of those per day. Now, there are those that are, if they're exercising more, if they tend to sweat a lot more, and that, we usually dive into a little bit deeper into lymphatics and drainage and all of that. But like, if you're sweating a lot, if you're exercising a lot, if you, have some sort of compromised gastrointestinal system, then you're wanting to add maybe 2 to 3 glasses over that amount. So anywhere from 10 to 15 for those types of patients. But I've had patients that have high blood pressure, and this one particular patient comes to mind. He was drinking 5 liters of water a day, no electrolytes. So that's all getting processed through the kidneys. And his blood pressure was skyrocketing. And we figured out, bring it down to 3 liters even, and his blood pressure was normalized. So I do now, because of that patient, I do keep in mind, like, too much of a good thing is also not good, right? So pretty much 8 to 10 glasses of water a day is what I recommend to 90% of patients. The electrolyte is Noon electrolyte, which is, no aspartame. So it's a good one to recommend. And I usually say to put that into one bottle. So one 2 cup bottle. So usually patients have like a 500 ml bottle of water. Put that in once a day. If you don't have the electrolytes, a pinch of Himalayan pink salt goes a long way. What I describe electrolytes as being is the kind of helper handyman to the water to actually get to where it needs to go. Because just drinking all the water without having that attachment of the electrolytes, like where salt goes, water follows, and pretty much where that's what the electrolyte is doing, is helping it to get to where it needs to go in the liver, in the kidneys, in the skin, and helping to actually flush everything out. And I've learned that from not having a colon, the importance of the electrolyte. So see, it's like becomes individualized medicine for me, and then I'm giving that off to patients. So if you were to see another naturopath, maybe they would say electrolytes, like only do that if you're exercising a ton. But I see the importance of like a pinch of Himalayan salt in 2 cups of water, or one of those Noon electrolyte tablets in 2 cups of water just once a day is good. And I usually, if patients are saying that they're peeing a lot or don't have a lot of energy, that's sort of my clue as to saying maybe you are somebody that would need the electrolyte. And so that's my recommendation for that. And then the blood work is usually, it's called a healthy living panel with Life Labs. So that'll be your basic, red blood cell, white blood cell, immune health, looking at your kidneys, your liver. But then what I like to ask patients to do, and again, it's individual, is do you need an enhanced thyroid panel? Because we in BC only get TSH, and that's thyroid stimulating hormone. That doesn't tell us what's going on with the actual thyroid hormone, like actual T4, T3. TSH is what's coming from your brain to tell your thyroid to produce more or less thyroid hormone. And then I had mentioned autoimmune conditions, like Hashimoto's is an autoimmune thyroid condition. We want to see what's going on with the actual antibodies. Like, is your immune system reacting negatively to your own thyroid gland? And we would see that with a raised anti-TPO, thyroid peroxidase antibodies in the system. So then it becomes about what am I looking for to enhance that particular lab requisition or blood work. But a basic healthy living panel, again, 99% of patients are good with, but there are those that need, women's health, women's fertility add-on, hormonal health. There's a fatigue assessment. So I usually like to also add AM, PM cortisol. Again, we could do another whole 45 minutes just on that, but that really tells us what your stress hormone is doing and whether you're, entering adrenal fatigue, not adrenal exhaustion. That's usually an extreme case, but I would say 75% of our population probably is entering adrenal fatigue. And that's a big one. The blood work is just a snapshot. So saliva, urine is a lot better, but it gives me a snapshot as to what's happening with your cortisol in the morning and in the evening. And that's a commitment for the patient as well, because they have to invest in their health by going in the morning to the lab and then going that same evening to the lab. So I choose those patients carefully. I'm not just going to tell anybody to do that unless it's really needed, but that's usually my add-ons. Ferritin for iron is an add-on. And then for men's health, the PSA, the prostate specific antigen, and the free available testosterone and bioavailable testosterone. There's a difference between the two, but those two for male health. And cholesterol is included in the healthy living. So healthy living to take away is like the biggest one for blood work.
Thank you.
Mm-hmm.
Wow.
Haley, you got any follow-up questions to that? I wanted to give you a chance because I know you have to go.
I've learned a lot. That's my takeaways.
No, it's really good. And well, part of the reason that I wanted you to dig into the blood work a bit is not for, okay, if you're listening to this and you're like, oh, wow, that was a lot of information. The point wasn't to inundate you with information, but I love the way that you went through the specifics, Dr. Shabita, because it's to give you an awareness that there are a lot of specifics.
Yeah.
And you do have to advocate for them, whether it's through the help of a naturopathic doctor, through the help of any provider, or even just a reference to this podcast.
Yeah.
And you write down a few things, and then you go to your medical doctor and you say, hey, I've been having these symptoms. I've been educating myself, and I really think I would like to have my thyroid tested, as an example. That's something you might not have thought of before. So much of it is becoming aware and educating ourselves. And that's why we do what we do on this podcast, to get this information awareness out to you. And so I know, so Dr. Shabita, you work mainly with local, right? Like you're doing physical in-person visits. Do you do
and
any
telemedicine?
remote?
Yeah, and telemedicine. COVID, made that so easy and possible. One of the positive things from COVID. So I do telemedicine because it is so easy to do. I do a lot of physical exam tests in person, but there's a lot that can be done over telemedicine, like the hour-long initial visit, right? That can be done over phone or in as a telemedicine video appointment. So I do that quite a bit.
Okay, that's good to know, because she is an excellent resource for you. Whether it's working with you directly, we'll put your information in the description for sure. Or even just if they need a connection, right? Like you said, you can reach out to Dr. Shabita. I'm so thankful that you were able to join us today. Is there anything that we haven't asked you that, might be a challenge or another tidbit or piece of advice for our listeners that we might not have thought of?
I'm so sorry. I'm going to pop on and I say I have to go. So it was a pleasure meeting you, Shabita. Enjoy the rest of the podcast. Peace out, guys.
Okay, see you later, Haley. Thank you. Have a
Bye.
good one.
Nice to meet you. Thank you so much for having me on.
Bye.
Bye.
Yeah. So let's just hear your kind of like wrap up thoughts
Yeah.
or anything, any other piece of advice that you think, I should really share this with them.
Yeah, no, I think we got through a lot, and I love that you said, it's not to inundate your listeners with information that paralyzes them. It's so that they can listen to this episode again and just pick out what is relevant for me or what caught my ear. So just to reiterate, it's just a healthy living panel that you would ask for from your GP, the water recommendation, the electrolyte recommendation, and then the last point that I'll just say is the emotional health component. That's a big one. Like I said, to every one of my patients, I describe the healing triangle, which is physical health, mental health, emotional health. And then where does your center of gravity, where is it being pulled? Like, do you have a lot of backache? You're being pulled maybe to physical health. Do you have a lot of gut symptoms? Maybe you're being pulled to physical and emotional. But all of us we're being pulled in some direction, and it's a combination of those three. Obviously, overlying is, like I said, the spiritual consciousness. But so I think my takeaway is involve that mental and emotional and physical health more into your consciousness of that could be something that's going on with me, where it's not just about my physical health. What's going internally? What are my narratives in my head? What do I say to myself about myself? Right? Because it's all about perception. It's not just the emotions that we feel, it's how we're perceiving that particular situation. And what do I say to myself about me? What is your why? Like, really, because that's what it comes down to. It's not so that, we're measuring out the 8 to 10 glasses, so we're drinking enough per day. I don't want you to obsess about that. Obsess over what you're saying to yourself. And so many of us don't have those negative thoughts that just circulate and circulate and circulate. We don't have an off ramp, like I like to describe, and a counselor, a naturopath, a professional, a medical professional, even your GP in the 7 minutes, they have to, like Dr. Shahana, my sister, is a wonderful example because she does really listen to her patients. There are wonderful practitioners out there, many of all disciplines. So talk to them, and they have to then put you in touch with the right people. And that can be an off ramp for you to get that out and out of your head, because those negative thoughts need to kind of come out through your mouth to another person, help to piece it all together and figure out, why am I feeling the way that I'm feeling? And then it makes it a lot easier to make those healthy choices, because you're coming from a place of, oh, I get why I'm doing, why I'm, snacking on that box of cookies late at night, because that's my only time to relax. Or that's why I'm having like one glass of wine, it turns into 2 and 3 at night, because again, I'm trying to detox from the day. But I'll tell patients, you're toxifying yourself again. So figure out, why are you doing what you're doing? What is your why? Not just why you choose a career, but why are you eating that way? Or why are you choosing not to put something, more nutritious in your body? There's a reason, and don't be hard on yourself, because there's an easier way to do it rather than white knuckling it. So don't white knuckle your way through life. Make it easier on yourself and advocate for yourself, and get in to see your healthcare professionals, because they're they're there to help. Excuse me. So yeah, that's what I would say. Look
Yeah,
at the
and
emotional
they're there
side.
to help. And if you have one that isn't or doesn't seem like they're there to help you, it's kind of like if you get a bad haircut, just go get a haircut from someone else. Like,
Exactly.
it's okay to change if you're not having that connection with your practitioners. But since you were bringing up your sister as well, I happen to have a copy of her book right here.
Oh,
So if you're
wow.
watching us on YouTube, another resource for you, feel better. That is Dr. Shahana. So yeah,
Yeah.
that's you got. That's so cool. I actually didn't know you guys were sisters. I don't know if she put that in the email. Maybe she did.
Oh,
I was thinking that
crazy.
you were friends, but that makes so much sense now. So
Oh,
cool.
yeah, no, I'm so proud of her. She's,
That's awesome.
put all of that in. She was always like, her grade 4 teacher told her, you can reduce your workload and the amount that you put output through homework by 50%, you would still score over 100%. Like, she's always been just a top-notch A+ student. Very difficult to go through life with an amazing sister like that. But no, I'm very, very proud of her. And she has put in, some great information into that book. So yeah, use it as a resource for figuring out your emotional health. Like I say, that's a big one.
Yes. Well, both of you are absolutely incredible. And I'm so thankful that I got to connect with you, and Haley as well. I can speak for her. So thank you again. And if you haven't subscribed to this podcast yet, now's your chance. Make sure you share this episode with a friend, because it's going to help a lot of people. And in the meantime, be free, feel fresh, and live on fire.